There are over 40 million Americans that rely on the welfare system for support, and I am one of them. Now, I'll be honest, I actually had to Google the symptoms of my own lived experience to discover the research term benefits cliff. Do you know what the term benefits cliff means? Because in communities like where I'm from, Dorchester, Roxbury, Mattapan, we don't use research terms to define our lived experience. We live it, we feel it, and we call it like it is. The welfare system as we know it today is a trap. And together, we are going to walk through what navigating the welfare system actually feels like and move through a few action steps that we can take today to help shift millions out of this constant cycle of poverty. Let's begin with understanding my relationship with my case manager and my relationship with the system. If you were to ask my case manager about me, she would not tell you my story, she would read you my data. I am a household of 3, one mother with a set of identical 4-year-old twins. I am a graduate of the SNAP Pathways to Work IT program, and I currently work 22 hours a week, making $22 an hour as an IT help desk manager. And when my case manager would enter my data into the system would then generate a report that she would read back to me. I qualified for $700 in monthly food allowance. But what the system didn't say was that my stability was conditional and that I would lose it all for working just 3 extra hours a week. 2 months into my new job, my boss, he asked me to work those extra shifts. And before I agreed, I did what I was supposed to do. I informed my case manager about this temporary change, and I told my boss that I could only work 3 extra hours a week. But when my recertification date came, my case manager entered my data into the system, and the system generated a report that she then read back to me. My monthly food allowance was going from $700 to 0, effective immediately. Hold on now, because I just worked more and I moved further away from economic stability. Is welfare not a trap? Because what started as an economic loss didn't even stay as one for long. I became food insecure, and my childcare became uncertain because that was tied to my SNAP eligibility. And it's like every single decision after that started to become about survival, not savings. And that kind of pressure, it doesn't live in a case file. Instead, you feel that in your body. And I had witnessed this before. I actually watched my mama live it. So again, the benefits cliff wasn't that new to me. Growing up as a proud welfare kid, one of my favorite childhood memories is when my mama would trust me to swipe her EBT card around the many corner stores here in Boston, especially that blue one on the corner of Corbett and Morton, and she would always send me there with a list. Nah, let me get a 2-liter of Pepsi, a loaf of Wonder Bread, and a zebra cake. And sometimes she would even let me get a little extra for myself. Now, I wasn't one of those kids that really liked reading books, but I sure love reading everything else around me, including the store receipts. And I read that number on the bottom so many times, I couldn't help but notice the words that were printed right next to it. Remaining balance. And then my mind would start to do the math. If this is how much we had now, how much did we start with? How long could we make this last? And if I had just $1, how many of my friends could I feed? Because if I bought a bag of Fruities and a big popsicle and I chopped it up 4 ways, and then I also got a bag of chips, oh baby, the possibilities would be endless. After securing my purchase, I would head home and I would notice these big blue signs in nearly every store window in my community. It said, EBT, accepted here. And I would notice the people that were swiping those cards too. They were teachers, parents, veterans, and even homeowners. So that narrative that we're taught that there's a difference between a taxpayer and a welfare recipient never, ever held up in my community. And I stand here before you today as both. I am a welfare recipient, and I am a taxpayer. There is no real divide. And this is not about people refusing to work. There are 15.7 million Americans who work full-time and still utilize the government assistance for food assistance. So this trap catches everybody. And in 2025, I found myself at a networking event over in the Seaport area, a long way from that corner store in Dorchester, when I met a Harvard-trained gynecologist who shared with me that she had used EBT to help her get through medical school. I paused. Because in the communities where I was from, there were EBT accepted here signs everywhere. But where we stood at that present moment in the Seaport area and over on Harvard's campus, there were no signs at all. Same trap, different zip code. And that's when it really became clear to me. The welfare system is structurally designed to produce the same instability no matter who uses it. So the question can no longer be, oh, does the welfare trap exist? I mean, you just walked through it with me. And I have been studying this for years alongside the people who have been most affected by it. Because the lived experience and the research, they have always needed to be a part of the same conversation. So now the question becomes, what are you gonna do about it? Because if you were to tap 3 people in your network today to share this talk with, we just might be able to measure our success in about 5 years to see if we can get that 40 million people trapped in this constant cycle of poverty down to 30 million. And how will we do that, you ask? Well, we'll start by shifting the narrative, because we are all only one opportunity away from poverty. And a tax-paying welfare recipient could look like you, or they could look like me. There is no real divide. And navigating the welfare system is not a reflection of personal failure, especially when it is designed as a trap. Next, we can share the information. Because the social determinants of health and the benefits cliff have been studying the same symptoms for years. It is time for that research to be bridged and shared with the people that are most affected by it. Okay. And lastly, we must continuously advocate, because policy reform will take time. But community can act now. So please do not let this conversation stay in this room. I need for y'all to shift the narrative, share the information, and continuously advocate. Thank you.